Hello, welcome to WQE. My name's Lorraine Foles and I'm with Ushma Palmer, and we are going to give you the demonstration of our Health and Social Care Diploma Level 3.
Right, okay then. So what we're going to do first is just go through overview of what you'll be doing in the first year, so the various units that you'll be covering during the first year of the Health and Social Care Diploma. So those of you who are on this taster course should be for the diploma, which is equivalent to the 2 A levels. And so I don't know if you can see the PowerPoint in front of you, but we've got about 6 different units that you will be doing in the first year. So you've got units 1, 2, 3, 4, and 10 and 14. So they are your 6 units you do in the first year. Units 2, 3, and 4 are examinated units. So you will have an exam for those units in January. And then the rest of them are coursework based, where you'll be doing assessments in classrooms, we'll be doing all the delivery and give you time to do coursework. And then they will also be going out externally and be moderated. So the exams take place in January, but you also have the opportunity to resit those exams in the summertime if you're not happy with the grade that you get in January. If you wanted more information in terms of the units that we do, you can go onto the OCR Cambridge Technicals website and look under Level 3 Health and Social Care Diploma, and on there's further resources that will support you, and also past papers on the 3 exams that you'll be doing in the first year. So if you wanted to get ahead of yourself over the summer, then that's something you could do to prepare yourself for when you start the course in August. Okay, what we're going to do also during this presentation is just give you a bit of a snapshot of the different units that we'll be covering. So we'll be touching a bit about communication, a bit about nutrition, and then we've got a quiz at the end which covers all the units that we do. So if you have a pen and paper with you, just write down the numbers of units that are on the screen that you can see now, so you're familiar with it, and then you can obviously research them further later on after the presentation's over. So if you can't see that, it's units 1, 2, 3, 4, 10 and 14 that you do in the first year. Okay, has anybody got any questions on that at the moment? If you just type the questions down and we'll answer them. Okay, so can we have the next slide? Okay, so in health and social care, you have a number of different skills that are required to work in this field. Some of them are transferable into another field, but some of them basically focus just on health and social care. So as you can see, we have one already up there, which is empathy, communication. So can you type some more up if you can before we tell you about any more in terms of what other skills that we've got? So there's already quite a few on there, but if you can answer some more on the quick Q&A at the bottom and give some answers down on what other skills you reckon are required to work in the health and social care field. We'll give you a couple of minutes to do that, and then we'll have a look at your answers while you're doing that. So we'll give you about 2 minutes to write some more skills that you can think of. And then also, if you can state next to your skill, why do you particularly think we need to have that skill? So why is it important that maybe empathy is needed to work in the health and social care field, or communication? Thinking about the people that you're working with. So obviously working in this field, you're working with a lot of vulnerable people, young people, children, old people, people with mental health issues. So these skills are obviously very vital in those areas. So thinking about who you're working with, why is it important that these skills are, very important? So if you didn't know how to communicate, would that be sufficient working with somebody who has just been diagnosed with cancer, for example, and you weren't communicating with them properly? So next to your skills, can you just write a little bit about why you think you have to have that skill? So we'll give you about 2 minutes to write that down, and then Lorraine will look at the answers that we've got and go through what you've written. Right, let me see if I can see answers. Okay, so somebody's put, I was just, right, hold on. I'm just going to go through your questions because I've just opened it up. So you've got, I was just wondering why there were 3 health and social care level 3s. Do they mean anything different? Yes. So the 3 different level health and social care courses we do are the extended certificate, which is one A-level equivalent. So students generally do that with 2 other A-levels. Or you've got the diploma, which is what you've enrolled to do at the moment, which is a 2 A-level equivalent. And alongside that, somebody will do another A-level. And then you've got the extended diploma, which is equivalent to 3 A-levels, which means you don't do any other A-levels with that. Your program is just health and social care. So the students who generally pick that are students who want to go, are absolutely sure that that's the field that they want to go into. So we do have a lot of students that do health and social care extended diploma. But the only difference is the amount of units you do for each one. So for extended certificate, you will do different amounts of exams and different amounts of coursework. Similarly, for the diploma, it goes up a little bit, and then the extended diploma goes a bit higher in terms of the amount of workload that you have, because that's equivalent to 3 A-levels. On all 3 of those, you'll be going on work experience. Whichever one you did choose, you'll be going on work experience during your time. And we do ask, if you can find your own work experience, we will support you, but we also ask you to look around as well for your work experience. Does that answer that question, Amina? Okay, Umayma, you've said honesty. Yes, honesty is definitely a skill that you have to have. And it's because you show that that person can trust you. So if you can show honesty to the people that you work with, they are obviously going to trust and want to come back to you and want your support. So yeah, well done on that. So I'm just going through the list. Somebody else has put understanding. So to show that you can help in different situations. Yeah, well done. That's another good response. Patience, because it helps get through our thoughts back in order and gives us persistence to carry out things that will lead us to longer term things. Yeah, excellent, Melissa. Patience is a very key skill to have working in this field, because you've got different people that you'll be working with and different needs as well that you work with. So that's brilliant. Respect, this is a highly important to make us and others feel safe and comfortable, and this will also make communication much more effective. That's brilliant as well. Yeah, respect also is a very key skill in this field. Well done, Leah. And then we've got Angelina, who's put respect as well. In health and social care settings, you need to respect others and acknowledge everyone's differences. Yeah, brilliant, you do. Well done. And then we've got, do you have the baby project with the diploma or extended diploma? Right, okay, so you're talking about the virtual baby there, Jess. We do have it, but we didn't roll it out this year just gone because of the pandemic that we've just gone through. So it's something we can roll out again. We have 1 baby, so we would probably allow 1 student to take it out and look after it over a weekend. So we generally program it so it goes off on a Friday evening, and then it shuts down on a Sunday night. So you have full experience of what it's like to have a baby. So yeah, we have the baby, and it's something that we could roll out for the course. Okay. Reliable, yeah, good understanding of the task or topic, brilliant. We've got reliable again, and communication is a key due to dealing with people's emotions and their feelings and how comfortable they are. Yeah, excellent. Communication is a very key skill that we have to have, especially in this field of work, because you can't be a very aggressive, loud person when you're working with patients that are vulnerable and timid. So you will look into more about communication in Unit 1 on the course. So well done. Thank you for all the questions that you've put so far. We're going to move on now and look at something to do with nutrition. So I'm just going to ask my colleague who's on this with me to share that video with you. And so what is nutrition and why is it important? Can anybody tell me what nutrition is? If you, again, just write your questions and answers down, and I can go through what people are saying. Right, guys, did you understand? Did you kind of hear what I just asked you to write down? Okay, yes, well done. So Fatima started it off. She said, make sure your body gets all the correct nourishment and sustaining your body. So well done. That is important. Nutrition is giving your body food for health and growth. Yeah, well done, Iman. That is also why nutrition is important. Okay, what we're going to do is we're going to show you a quick clip, if we can get it working, on nutrition. About there's a boy and a girl on this video clip, and one's got one doesn't eat enough and the other one eats quite a lot. So we're going to watch this quick clip, and then I'll ask you a few questions on there. So I'll just ask my colleague to share that clip with you.
Okay, right, we're going to start sharing the video. Fingers crossed it works. So here we go.
We can't actually see the video, Lorraine.
Okay, let me refresh.
You have to get rid of this PowerPoint before we share the video.
Okay.
Okay, while she's trying to share the video, did you all, can one of you reply at the bottom just to say if you heard all my answers on the questions that you were asking earlier? Oh, brilliant. Thank you, Melissa.
Right. Ushma, it's not letting me do that.
Okay, let me see if I can share it.
Hi guys, we're having a few technical difficulties because we're not used to working in Zoom. We normally work in Teams, and we've been given a crash course on Teams. So we're just trying to get it to work for you. Some of the answers that you've been given have been absolutely excellent, so well done.
Okay, as we're having a few difficulties with the video at the minute, so basically what the video was about, I'll go through what the video clip was basically going to show you. You've got a boy in that video who's overweight, and you've got a girl in the video who's very slim and underweight. Both of them have a very poor diet. So what the nutritionist does in this clip is basically puts all their bad food in one tube and then all the girls' food in one tube. So both their food goes down a tube. And by watching that, you get to see how good or not so good somebody's diet is. So does anybody know in terms of what nutrients your body should not have too much of in terms of living a healthy life? So what should you not have a lot of in terms of trying to be healthy? If you can write some answers down. And what do you think you should have? Yeah, sugar. Brilliant, Amema. Sugar is probably one of the worst things we eat, and generally it's a thing that's easily accessible everywhere we go. So if you go into a supermarket, all the sugar items are the ones that are on offer all the time. So you'll find that when you go into even Boots waiting to pay for your toiletries, there's always chocolates and crisps and things there. So it's easily accessible, and everything we eat is sugar based. It's hard to kind of cut your sugar out, but you need to eat it in moderation. So they say the recommended amount of sugar is 4 grams, which is 1 teaspoon of sugar. So 7 teaspoons a day is what you're recommended to eat each day. Saturated fats, Freya, well done. Yeah, that's another bad fat to have. There are good fats and bad fats, but saturated is one of the bad ones because that obviously clogs up your arteries and also gains weight, makes people get fatter. And processed food, Angelina's put down. Yeah, so processed food's got high sugar, high salt, all the bad things, because it's made with all these other chemicals as well. So well done for answering those questions, girls. We're going to move on now to a quick quiz, and then we've got time for a few questions if you've got any more questions. So while we've got the quiz on, if you've got pen and paper, just write down your answers, and then you can start typing your answers onto this Q&A bit. And then if you've got any other questions about the course that you want us to answer, please type your questions on the Q&A bit at the bottom.
Okay, hi. Right, so let's have quiz time. We've got 8 questions there that are linked to the units that we're teaching health and social care. So let's see how many you can get right. Okay, so there'll be multiple choice questions. So sometimes there'll be more than one answer that's correct. So I'll let you know if you've got more than one answer, otherwise it's one answer. Okay, so we're going to look at the units. So building positive relationships in health and social care. We've already said communication is really important in health and social care environments, so let's see what you know. Question 1, non-verbal communication is just as important as verbal communication. Which of these choices are non-verbal? Okay, so you may choose more than one. So there's more than one choice here. Which of them are non-verbal? So we give you just 10 seconds on each answer. It's pretty straightforward. Okay, so the answer is all of them. Okay, you may have missed out voice there, but voice is really important. It's still non-verbal, because it's about the expression in your voice and actually the tone and how you actually talk to someone. Okay, if I was shouting at you now and I'm really angry, okay, then you would be taken aback by what I say. Okay, question 2. Did you get that one right? Question 2. Okay, unit 2. Which of the following is not a protective characteristic? Okay, so one of those is not a protective characteristic. Which one is it? Okay, so if you put C, you are correct. So have you got 2 out of 2 so far? Okay, unit 3 is our health and safety and security unit. Okay, at a minimum, how often must the healthcare workers wash their hands when performing patient procedures? Okay, only one of these answers is correct. Okay, so if you put C, you're correct. Okay, question 4. Anatomy and physiology, my favorite unit. This is your exam unit. Okay, which one of these is not associated with the respiratory system? Okay, if you said B, you've got that right. Bicuspid valve is actually in the heart. Okay, so it isn't associated with the respiratory system. Okay, question 10, our nutrition unit, the unit that we're currently doing with our groups. What is the primary purpose in making sure your body receives carbohydrates? Okay, if you put D, you've got the answer correct. Well done. Okay, unit 14, this is a true or false answer. Okay, people living with long-term conditions are more likely to experience physiological and psychological problems. Is that true or false?
Iman's put true.
Well done, totally right. Okay, one of the things that we'll be looking at in unit 14 is actually the impacts of these long-term conditions on people, and it's not purely about the actual condition itself on the body, but it's also about how the body responds mentally as well, and the pressure it puts on their associated family members and their care workers. Okay, Unit 7. Oh, this is one from the earlier bit, the PowerPoint. One skill is missing. I wonder if you can work out which skill is missing. Really important in health and social care. Okay.
Teamwork. 2 of them have put.
Excellent, well done. I can't see your chat at the moment because of the PowerPoint being in the way, but teamwork, we all need teamwork, especially in the health and social care. And a lot of the things that you're going to be looking at in health and social care is about partnerships working together to make sure that the person-centered approach is always used. Okay. Question 8. Okay, this is where the units you've just been looking at, which unit is worth the most points? Right, Ushma, has anyone got this one right?
No, not yet. No one's put an answer down.
Okay, the answer is Unit 4. Yeah, Unit 4 is more guided learning hours, and so that counts for more points than the other units. Okay, so that's a really important exam unit that counts for more points. Okay, question 9 is your question. Do you have any questions for us?
It was lovely that you all joined, and thank you for participating and answering the questions. And hopefully we've covered everything that you want to know at this point. But obviously when you start the course again in August and you enroll properly, we'll cover a lot of this again in more detail as well.